About a month ago, I was having lunch with some colleagues, and one of them mentioned they didn't know that someone can work 40 hours a week and still have food insecurities. Normally I'm quiet, but that particular day, that statement kind of, jogged something in me to be transparent, to be open with the group. And I shared with them that I was one of those people that work 40 hours a week that have food insecurities. So I have two jobs. My first job is a full-time job. After my rent, my car insurance, car payment, utilities, all the necessities, health insurance, all of that good stuff, I have about $100 a week. And my second job, I just use it to fill the gaps where I need it. My story isn't unique. There's a lot of people out there that have kids that they're supporting, that works two jobs, that work 40 hours a week, and that doesn't have a support system, that doesn't have time out from their kids, that doesn't get a break. I feel that this program would be very beneficial to a lot of people out there. There's a misconception that there's government programs that help everyone, but sometimes you just hit that limit where you make just enough and you don't qualify, you're not eligible. So when employers have their own program, have their own system, it can be a huge help to the employees.
Food insecurity can affect people from all walks of life. Millions of people in America are just one job loss, missed paycheck, or medical emergency away from food insecurity. Families may be experiencing food insecurity but may not qualify for federal nutrition assistance programs. This leads to a greater need for us to address the gaps between food insecurity services available and populations who are able to access them. In the healthcare sector, we're transitioning from treatment and sickness to prevention and wellness. There is a need to invest in cost-effective strategies to improve health outcomes and address social determinants of health and health disparities. The zip code in which an individual lives can be more of a health determinant than their genetics. This is why we aim to do what we do.
There are a lot of people who are struggling. I see a lot of single mothers who basically are working 2 and 3 jobs at minimum wage. In some occasions, they get paid once a month. They run out of money before the end of the month. But I have one family that had a single mother with 4 children, and each child was given the responsibility of preparing the meal for themselves and the other 3 children. And then she'd give them $5 to buy the meal that was to go for 5 children. And they did what children do. They picked out their own preferences. One of the little boy always liked Vienna sausages. The other kids didn't. And they would get a Vienna sausages and a Snicker bar one day, and they would get bags of popcorn. But basically, one of the little girls passed out in school and was brought home by the school nurse for malnutrition. So these are things that we see.
Food insecurity is preventable. Thanks to the Florida Blue funding for our Ending Hunger grant, we are building skills to stabilize and navigate individuals towards food security in 4 specific ways. First, education and income intervention. Participants will attend 21 training sessions per year for financial and nutrition education, paired with an income intervention of 30 payments per year in the form of $40 gift cards to supplement their food budget. These payments are front-loaded, meaning as participants progress through the year, the payments become less frequent. The thought being, as they receive financial and nutrition applicable skills to make better choices, their dependency on the stipends will decrease.
Second, Student-Intern Immersion Training. Dietetic and social work students led by Tallahassee Memorial Behavioral Health and Sodexo dietitians will provide one-on-one education in nutrition and financial management. Among other topics, we will teach participants how to shop for healthy items at a grocery or dollar store and how to create a sustainable budget. In addition, educators will identify other needs and connect participants to appropriate community partner organizations.
Third, community seminars and workshops. In order to truly establish food security, we must meet people where they are. Many combined factors affect the health of individuals and communities. Factors related to food security are largely influenced by the zip code we live in. Working with employee assistance programs partners in underserved communities, we will hold educational seminars and provide food vouchers to attendees throughout the year.
And fourth, a food security summit will bring together local leaders and community stakeholders to share our progress and build bridges to other organizations in our region to make an even bigger impact.
You know, the positive side of this is we see results every day in the EAP. People who come in and are willing to ask for help, and we'll do everything we can to figure out how to help them and how they can be stable and prosperous and functional.
Florida Blue, without you, none of this would be possible. Working together, we are ending hunger and helping people build the skills they need, both financial and nutritional, to put them and their families on the path toward food security.